I think we'll get going. We're a little bit of a limited time schedule. So welcome everyone to this first session of the COVID-19 discussion fora, where we bring together alumni and students and staff of the Center for Human Rights to discuss issues around how COVID-19 is affecting the continent. And today we are looking at exacerbated vulnerability in the context of COVID-19, and we have four eminent speakers from our alumni with us. Samelu Gumetse from Swaziland, who is a member of the working group of the United Nations of people of African descent. Joseph Akech, who is advocacy and governance director at Save the Children in South Sudan. Theophilus Odadu, who is with the Disability Rights Fund in Nigeria, and Jama Jack, who is a Gambian activist in relation to women's rights in particular, and is also on the front line of how they're dealing with the COVID-19 pandemic in relation to testing and so forth in the Gambia. I see that she hasn't joined us yet. I hope that she will do so very soon. But in the interest of time, so our themes here in relation to the vulnerability is in relation to racism, children, disability, and women. And as the presenters make their contributions, you can make comments and questions in the chat. If I see that we have many questions, I will do a little selection and ask you to make your questions at the end of the session. Otherwise, we have it as an open session. I see we are around 50 participants now, so it's not too crowded. So, Sabelo, we start with you.
All right.
And
well,
I'll keep time quite strictly, so I'll indicate when.
All right. Thank you very much, Magnus, and welcome to the viewers. My task is basically to look at the response to COVID-19 in relation to people of African descent. As you know, that the African diaspora is the sixth region of the African Union, it's important that we also discuss about what actually obtains outside the continent of Africa when it relates to people who are of African descent. And I must say that as an introductory remark, that racism, racial discrimination, xenophobia and Afrophobia and related intolerance against people of African descent is unfortunately a reality that has been worsened by COVID-19 and the response to it. My task today is just to look at what has actually happened in China, what has happened in Europe, and also what has happened in the US, just to pick a few parts of the world insofar as how COVID-19 has been responded to and how it actually impacts on people of African descent. I must say that the response to COVID-19 and its impact on people of African descent actually mirrors the disparities which have existed for over centuries. As you know, people of African descent have suffered from the enslavement phenomenon. They've also been subjected to colonialism, to apartheid, to neocolonialism, and so on and so forth. So the response to COVID-19 and how people of African descent have actually been impacted upon by the virus should be actually looked in context of what people of African descent have actually been subjected to for over centuries. Now, I must also mention that while there are states that are actually collecting disaggregated data on the impact of COVID-19, particularly looking at the issue of race. Others, unfortunately, do not do that. But we are of the opinion that it's important that when states are actually reacting to or responding to COVID-19, disaggregated data based on race should be one of the considerations that they must look at, so that when people of African descent are actually pinpointed as one of the vulnerable groups that are impacted upon by COVID-19, then special measures should be actually directed to them. So when it comes to the issue of China, I mean, we know that the virus originated from China, and in China, you have people of African descent who comprise of migrants who are working. There are those that are also involved in business. There are also students. And I must say that, unfortunately, a few African states took an initiative to facilitate the return of their citizens based in Guangzhou. Well, South Africa is one of those countries that have actually taken that initiative to bring back its citizens from China. I must say that it was quite unfortunate that some states in Africa would even say that, you know, those who are actually based in China must not even come back home because they will be spreading the virus. When in fact, these are African citizens, and I think it's important for African states to be responsible for their own citizens that are beyond the continent of Africa. So during the second wave of the COVID-19 infections, we saw people of African descent being subjected to untold suffering. For example, there were those that were locked in their apartments. There were those that were hunted like animals to be tested for COVID-19. There were those that were evicted from their apartments. There were those that were refused entry into restaurants. We saw the example of McDonald's and other shopping centers on the media. We also had those that were forced to be quarantined despite the fact that they tested negative of COVID-19. There were also those that were harassed in the streets, trains, etc. So what we are seeing here is actually a state-sponsored narrative or stereotype against people of African descent, that they are actually the carriers of COVID-19 while the rest of the population remains pure, which is a very unfortunate situation that we have seen. Now, when it comes to Europe, I must say that there is a very interesting report called Being Black in the EU, which means no words. It says that racial discrimination, harassment of people, and harassment against people of African descent is actually commonplace in Europe. So we must also look at the response to COVID-19 within that context where people of African descent are actually subjected to discrimination and so on. So they face a widespread and entrenched prejudice and exclusion in that part of the world. So now when it came to the response to COVID-19, we saw that people of African descent work in essential industries, and they are more vulnerable to contracting COVID-19. We also saw a large pool of Africans who would actually migrate to Europe to work as doctors, as nurses, as caregivers, and they are even more vulnerable to COVID-19. The statistics that we have seen so far, we have seen that the people of African descent are dying of COVID-19 disproportionately when you compare it to other races. And this is as a result of the fact that you have health inequalities in Europe, where Blacks have even complications related to diabetes, cardiovascular diseases, as well as cancer. The people of African descent live in poor conditions. They live in crowded housing. You also have a proportionate poverty levels in the case of Europe. And people of African descent are in the majority. People of African descent are actually paid low wages in Europe. Now, when it comes to the US, we have also seen a large proportion of people of African descent suffering the most. And within this vulnerable population, older Black people are more likely to die than their white counterparts. Again, this must be looked within the context of how people of African descent in the Americas have actually lived over the centuries, stemming from the time of enslavement and so on. We have also seen African Americans mostly concentrated in urban areas as well as working in essential industries. So as other people are told they must stay at home, they are actually forced to be out in the streets and going to work and so on. And this is actually causing them to be more vulnerable. The poverty levels, we know that in the US, for example, African Americans have are in the majority of those who are poverty stricken, and they also have inadequate healthcare systems, which unfortunately does not favor people of African descent. You also have African Americans who have higher rates of diabetes, hypertension, and heart disease. So these are actually factors that make them to be even more vulnerable to the virus. So in conclusion, as the working group, we have issued quite a number of press releases urging states to actually put human rights at the heart of the response to COVID-19 pandemic. We have also urged states to depoliticize the issue of or the response to COVID-19, as we have seen in some states where now it's just mudslinging, politicians blaming each other for not responding to the pandemic. I don't want to get into that, but suffice to say that within the Human Rights Council, you do have the special procedures of which the Working Group on People of African Descent is part of, and there are many press releases that have actually been given out, urging states to address the issue of COVID-19, focusing on the human rights aspect of people of African descent and also other races. So I will end it there, and I'll be happy to engage more as we proceed.
Thank you very much. You kept exactly on time. We turn to Joseph on how children are affected in this context.
Very good morning, everybody. My name is Joseph Akech. As Magnus said, I work for Save the Children as Advocacy and Campaigns Director. It's a pleasure to speak to you all about the implications of COVID-19 on children's rights in Africa. I would like, however, to state that I will not be speaking as a Save the Children representative because I've not been authorized to do so, but I will share experiences from Save the Children as we see them affecting children on the African continent. So of course we saw the announcement by the World Health Organization that COVID-19 was a global health emergency, and that followed governments around the world, measures that are called to flatten the curve or reduce the spread of this virus. And one among such measures has been the closure of schools and all learning spaces, restriction of movements, and some countries, as you've seen, lockdown, total lockdown. And so we've asked ourselves as Save the Children, what has been the implication of this on the rights of children? And Save the Children operates in many places around the world, 120 countries, and so we have a global understanding of the situation for children in that regard. And so one of such implications has been the closure of schools. The children are not allowed to move around, affecting their recreational activities, but more importantly, not being part of decision-making as to these measures being taken. In many countries where we don't have structures that allow children to participate, there has not been a meaningful consultation with children in taking these measures, which we see as a concern as well. And so, in particular, when it comes to education, governments have said that schools will be closed, but there is no timeline that's given. Some countries have locked down schools for a certain period, but that is being, continued every now and then. And as a result of this, some countries have decided that they would like to continue education in some form. And one such measure is to, offer distance learning. And distance learning takes place in different forms. For countries that have internet connectivity, they do lessons through internet. Others will do recording or radio, and then this is shared with children in their communities. And we see that as a major concern in terms of human rights for children, because children with disabilities, children in poor backgrounds, children without access to these gadgets that will allow learning to take place, distance learning to take place, are likely to be left behind. And we see that as a regression to the promise the world has made, that by 2030, no child should be left behind. And how is it possible that distance learning is continued that may legitimize the exams calendar and that could potentially leave many children without access to education? And more importantly, the messages that are going out in many countries are not being done in consultation with children. Children don't interact with these notions quite easily, yet it is a disease that affects children, although the statistics seems to show that children are not dying from it that much. Children should be stakeholders in knowing about this disease, how to protect themselves, but also they should be part of getting to design the messages, especially in rural areas where they don't have access to radios. But actually, behind the closure of schools and restriction of movement, we have also seen that some governments are beginning to restrict civic space that is already there, which is impacting on the rights of children to politically engage and express themselves. And these decisions, if not addressed, could actually mean that children do not have certain rights going forward, because to undo these decisions might mean civil society engaging with those governments going forward. And so in places like South Sudan, for example, where we have large programs, we have engaged with the government to ensure that children are consulted in decisions that affect them, especially the closure of schools, that they are aware and are informed about when the schools might open, and that their civil and political rights to participate and express themselves is not taken away indefinitely. We are confronted by this idea that, well, it's a balance of health safety and certain rights have to be limited in this regard. And we say, but if that was the case, then children will need to be part of the decisions and discussions about when these changes might when the decision might revert back to children enjoying the full right to participate, for example. So what these measures have shown us over and above children's rights is that, especially the advocates of governance and human rights, is that the political space that is there in Africa would need to be constantly checked, so that when public emergency occurs in the way it has done, that the democratic safety valves that are there are able to allow popular participation of children and vulnerable people to take part in decision making, because it's not obvious that we are consulted, as we have seen in the examples. So what we have done at Save the Children is appeal to government to increase public financing, especially around health and protection of children who are vulnerable already, but also calling on international community to increase funding towards countries that are poor, because the health financing and status is already bad in many countries in Africa, and to not allow regression in cases that have been made especially around putting 2.2 million children who are out of school in South Sudan back to education, and not allowing governments to further restrict civic space that is there, so that gains made around democratic reforms are not taken away under the pretext of this public health emergency. So I will leave it there, and I will engage further with you in the questions that you may pose. And I can also come back to share a lot more if there is time for comment.
Thank you very much. Theophilus, on disability issues in the context of COVID?
Okay, thank you very much. Good morning.
So Theophilus, if you can turn off your video if you have it available, otherwise it's fine. Okay.
That's fine.
Yes,
okay.
Thank you.
Okay, so good morning, everybody. I'm happy to be here today at this forum to discuss how the COVID-19 is affecting persons with disabilities across the world, especially here in Nigeria. My name is Theophilus Odaudu. I work for the Disability Rights Fund as Program Officer for Nigeria. In the line of my work, I have interactions with persons with disabilities and organizations of persons with disabilities here in Nigeria as we push for the advancement of disability rights in the country. One thing that is obvious with the COVID-19 pandemic is that it has exposed the poor level of protection that persons with disabilities enjoy to basic human rights, such as rights to health, access to information, right at in times of disasters and emergencies. So our experience here shows that persons with disabilities are left behind in many areas of COVID-19 response by the government and by several interventions that have been put in place. So by persons with disability, by nature of their disability, are affected in diverse ways, and it is very difficult to use a one-size-fits-all approach to address issues on persons with disabilities, which is what the government tend to do at the initial stage of the pandemic. First of all, persons with disabilities were excluded from basic information, tips about prevention measures and what to do when one falls sick and where to go to. For instance, persons with deafness were not able to get information in accessible format because most information were passed through the radio or through the television, and most of these do not have sign language interpretation or captioning. And we also have instances where messages were sent via picture messages and do not have captioning for the blind who use screen readers. So in such instances, persons with disabilities were not able to get information on time and on the same level with others. People rely on third parties to get several of such information on how to cope in time of this pandemic. By the nature of disability, persons with disabilities are vulnerable in times like this because they rely heavily on assistive technology and human assistance to carry out basic daily living tasks. For instance, the deaf-blind rely on touch and different form of sign in order to communicate. The blind rely on interact so much with surfaces in order to move around. And even those on wheelchair could have their chairs infected around the process and get themselves infected as they also interact with the wheelchair, trying to move themselves around the environment. So in this way, we can see how persons with disabilities are vulnerable and are easily exposed to the dangers posed by this pandemic. In many instances also, where messages are sent out to persons about the virus, these messages are usually not in simplified languages. They are using highly technical terms that could be difficult for persons with intellectual disabilities to understand. So these examples will show that there is no one approach to addressing issues of persons with disabilities. The only solution is to be inclusive in our approach. And it was difficult for Nigeria because we do not have a disability disaggregated data. And so when the whole thing started, we see when persons with disabilities started advocating to be carried along, the government was helpless because it doesn't have this information about persons with disabilities, where they live and their conditions. And that makes it difficult to be able to get to them. The government has put several interventions in place because for many states in Nigeria, there have been a stay-at-home order. Movements have been restricted, businesses are closed, schools, worship centers, and several offices are closed. And so the government put in some measures to provide palliatives for persons with, for the vulnerable in the society. And when the government used that term, it excludes persons with disabilities because it assumes that when it gets to the poor, it gets to everyone. But the places where these interventions get to the people, in most cases, are not accessible to persons with disabilities. And if you've seen some of the videos online, you could see the struggle that people go through to access some of these support, which of course are not possible for persons with disabilities. Disabled persons organizations have taken up the challenge and have been speaking to government about how to carry them along, and they need to work with the organizations of persons with disabilities because they know their members and they know how to get to these people. Another area is in terms of health response. The facilities that are being put in place hurriedly to respond to the COVID-19 crisis are done without any consideration for the needs of persons with disabilities. And so one begins to wonder, even though one doesn't wish that anyone goes down with the virus, but as people who live in the society and are most vulnerable, we could see how persons with disabilities can easily get exposed. And in such a situation, we can see how difficult it will become to access a lot of the isolation, testing, and treatment center. We have a case of a deaf woman who felt ill and seeks to access testing. It was a difficult situation for her because communicating with the officials that came to take her sample was a lot difficult because there was no sign language interpretation. The health workers are not trained on how to attend to persons with disabilities based on their the peculiarities of their disabilities. So we could see that to a large extent, persons with disabilities are left behind in the COVID-19 response here in Nigeria. And the report is not also different from what we also get from other parts of the world. It therefore shows that the address of the issue of leaving no one behind is observed more in statement than in action by the various governments of different countries, especially that of Nigeria and other African countries. We are working with disabled persons organization to step up advocacy to the government, be able to include persons with disabilities in all levels of intervention and response to COVID-19. Some results have been achieved whereby a state have included a person with disability in the state task force that is handling COVID-19 issues in the state. Some NGOs have supported the government with sign language interpretation during the presidential task force briefing, and that has increased the level of information that gets to persons with disabilities. I would say that when information are not accessible and when facilities are not accessible, of course, persons with disabilities are discriminated against and their rights are violated. Can only continue the work, the advocacy, and hoping that the government will listen and begin to make necessary adjustments so that beyond COVID-19, steps will be put in place to see that the issue of leaving no one behind is actually projected and is prioritized in all aspects of governmental affairs in Nigeria and all over Africa and the world at large. I will stop here for the interest of time and wait for any questions and any opportunity to make further comments on persons with disabilities and COVID-19. Thank you very much.
Thank you very much, Theophilus. Jama, your intervention on women's rights, particularly sexual reproductive rights in this this context.
Good morning, everyone. Thank you, Magnus. So, as we know, there's been a lot of conversation around what the impact of COVID-19 is on women, and there are so many broad perspectives. I have been asked to look at the impact on pregnant women and what their vulnerabilities are within this period. So I currently work as Head of Communications at the Medical Research Council in the Gambia, which is also the only testing center for COVID-19 in the country at present. And I will be sharing perspectives based on what we're seeing from our clinical sources that we the community. But globally, there have been a lot of concerns raised on the impact of COVID-19 on women's health, especially where it relates to violence and maternal mortality. Now, the concern is on women losing access to health services and social support in their communities as well. So pregnant women have been identified as part of this vulnerable group because they're in need of antenatal care, but some of them are unsure of whether they should still keep attending the antenatal clinics. Some of them are unable to move because of the lockdowns and stay-at-home orders that exist in some countries. And in some health facilities, they're downscaling their services to have their medical professionals focus on COVID-19 response and in some cases, emergency services. Now, currently there's limited data available when it comes to determining the risk level of pregnant women from an infection perspective. Now, there's research going on to determine whether there's an increased susceptibility among pregnant women, but also to determine the possible transmission. So that's mother-to-child transmission of COVID-19 among pregnant women. All of these are being made within the context of references to what happened during the Ebola outbreak, where there's a huge surge in maternal mortality in countries like Guinea, Liberia, and Sierra Leone during and after the outbreak, because a lot of women stayed at home and stayed away from the health facilities because of the quarantine restrictions, but also because of misconceptions and how the virus is transmitted. And so we saw a lot of them being forced to stay at home and deliver their babies, which is also risky and places them in a very vulnerable position. Beyond that as well, there's been an impact on vaccination programs for their babies when it comes to tuberculosis, measles, and yellow fever, because the women did not attend postnatal appointments in the health facilities. Now, we're already seeing this being repeated in countries like the Gambia, for example. After we announced our first case, there was a sharp drop in the number of people turning up for their clinical appointments in our clinic here at the MRC. Now, this is also happening in public health facilities, especially across the country. And this is mainly due to fear among the women who believe that moving into these health facilities where there could be potential cases of COVID-19 would put them at risk of infection, but also because there is a very huge gap in information transfer on what this virus is, how is it transmitted, how you can protect yourself. Like I mentioned earlier, there's also a downscaling of services offered, which means that sexual and reproductive health services further pushed down the priority list. We have seen cases in Gambia where women go to public health facilities to request sexual and reproductive health services, and they're turned around and told we're only dealing with COVID-19 cases and also emergency cases. So basically accidents and very serious cases that are linked to physical health. Now, public health facilities, which are basically more affordable for the greater population in here. And this means women are now being forced to start looking for these services in private health facilities, and they are usually not able to afford these services. And this is worrying as well, because in the Gambia currently, we have only recorded 10 confirmed cases. And so you cannot really talk about a huge pressure on the health system at the moment, which would warrant these decisions being taken. So one can only begin to think how much more vulnerable are women going when we begin to record more cases, when we start to peak, when our curve starts to peak. So that is worrying, and it has implications on their rights to access health, but also their right to know what exactly is happening and services be able to see. We've seen the example of Uganda, for example, as well, where there are records of at least 11 pregnant women who have died because of the transport ban. So they're unable to get to the health facilities in time because of the restrictions on movement. And so they lost their lives. A very tragic reality. Now, there have been increases in gender-based violence cases. There have been increases in the burden of domestic care, especially now with schools closed and children having to stay at home. There is the increased responsibility of mothers, especially based on what gender roles exist, based on what gender norms exist in our communities. And pregnant women are not exempt from this reality. They're having to take on more responsibility in their homes of providing care to children in times where they may have been able to rest when the children are in school. So the deprioritization of activities, that's an obstacle. The fear of the spread of the virus also hinders access to services. What is being done globally? There's a lot of discussion on the global scale, but also in countries as well, that we are trying to follow. One of the biggest calls is for governments to ensure that their COVID-19 response is rooted in feminist principles. Talking about ensuring you're not leaving people behind, and this goes beyond just women. It looks at different vulnerable populations. The UNFPA has provided a position paper that's calling on government to maintain sexual and reproductive health services, which also includes antenatal and postnatal care for expectant women, but also looking at access to modern contraception and emergency contraception, and safe abortion and post-abortion care. Now, they're also pushing for priority testing pregnant women with COVID-19 symptoms, especially in countries where their case definition is really what is guiding testing, which means a lot of people are not able to access testing services. But they're also calling for isolation of pregnancy wards from COVID-19 cases to reduce the risk of transmission, which is relevant for countries where there's weak health systems, and it's basically a lot of learning that is happening with the response as well. And they're also calling for an elevation of care for pregnant women with respiratory illnesses. Academic forum as well. You have the Women's Pro Bono Initiative in Uganda, which is led by an alumni of the SRR program in the center as well. And you have Think Young Women in the Gambia. There's UN Women. At this stage, there's a lot of calls for governments to really reconsider what response looks like and how it takes into consideration the needs of different vulnerable populations. Some of the recommendations that have been made is for states to declare SRHR services as essential, and to ensure the continuation of medical support, especially for these vulnerable groups, but also to make sure that when these services are continuing, there is steady information flow to the population to understand that these are the services that are still available. This is where you go to get them. There's also recommendations to get them to ensure that lockdowns take consideration of the needs of vulnerable populations and are not just copy-paste processes from countries which have better systems, that have better care processes and services for vulnerable groups. And the other one is also for them to consult with women's groups. organizations consult with these vulnerable populations to understand how better to provide the services that they need. The final one, because I work in a research institution, is for timely research to happen so people can understand exactly what the risk factors are, and we're not dealing with retrospective interventions that would mean that some women may have already been affected in very serious ways. I will stop here, and I'm happy to engage and take any questions. Thank you.
Thank you very much to all our panelists for your very good insights on these various issues. Thank you to everyone who has joined us in the meantime. I think we started out this morning with 50. We have now 84 participants. We'll also post the whole session on the center's YouTube channel for anyone who wants to refer back to it. But we'll go over to a question and answer session now, or comments that you may have. We've had a little bit of discussion on the on the chat. So just pick Michelle. You had a question around, I think, for Sabelo in relation to racial discrimination in China. You want to post the question?
I'm not sure whether I can respond now, but I'm
yeah. So I guess you can just cover the issue if we don't.
Okay. Now there was the first question from Professor Filyun around the what other measures are at our disposal. As the working group, our mandate is to study the situations of people of African descent in the diaspora. And one of the things that we have done is actually to work on an urgent appeal that will be sent to the Republic of China, where we will be stating all the allegations of human rights violations against Africans or people of African descent in China. And then we will allow the government of China to respond to that. And then that engagement is usually an engagement that is not in public. So it's just between the working group and the government that is responsible. So that is one. And then the second one, as the working group, we can actually undertake a country mission to China. But this, I must say that it only depends on whether the Chinese government agree to invite us into the country. And that's how we then able to meet with all the stakeholders, and then at the end of the day we issue a report on our findings. I don't want to say this is very much unlikely, but this is what is actually happening with the mandate of the working group. Now, there was also a question relating to the public fury in Kenya. I must say that in brief, when it comes to human wrongs, they cannot be addressed by violations of human rights. And I think in response to what the Chinese government has done or what is happening in China, I don't think we then have to be violating more human rights, particularly when it comes to people of Chinese descent in the African continent. Now, there was another question that was directed at me. How do you prevail over the government of China? Within the human rights system, international human rights system, we also have what is known as the universal peer review, where now when it comes to the Committee on the Elimination of Racial Discrimination, when it is the time for China to submit a report, there could be shadow reports that could be submitted to the CERD, stating what has actually happened, so that China is also given an opportunity to address those issues. So this is one of the issues that will come out during the next universal periodic review of China on what they have actually done to address this particular issue. So I will stop there for now and allow others to respond.
Thank you. Joseph, you also had some questions in the chat. You want to address them?
Yeah. So I have 3 questions, one from Tariro, Dr. Zubike, and George. So I'll start with the first one, which is on overcrowding measures. So at the moment, schools remain closed. When they open, I hope at that time the threat of coronavirus would have gone. But the issue of overcrowding is pre-existing issue. And because we don't have many classrooms across many places in Africa, and we have children crowded in classrooms. So I think at the moment, firstly, we don't have measures because schools are not opened. And if they reopen and there's a need for classrooms, one of the measures we advocate for is accelerated learning program, which allows then children to come at different times because the classes are condensed. But also the option of distance learning might be pursued. But I think that will be followed up by different countries depending on priorities that they would like to pursue. But our message would be that if this was done, it shouldn't allow children to be marginalized and left behind and discriminated against. All children should have access to education at all times. The second question about what we are doing around the crashing of oil prices. South Sudan is one such victim. We depend largely on oil resources. So 3 things we have done so far. We've written letters to G20 asking them to provide much needed financial assistance to 4 countries so that they can tackle child-related illnesses. We've also engaged on debt relief so that countries that are paying debts to these European nations and in financial institutions are not paying anymore, so that then they have funding available to provide urgent medical assistance to COVID-19, but also recovery thereafter. But I think in the long run, we are doing analysis and we have an expertise in this, so that countries really, consider to look at their national priorities, and that might mean expanding the national envelope, collecting more taxes and allowing education and protection services to continue as a matter of priority. But that still remains also and will remain within the national politics. It's normally a long-term advocacy issue. On the question about approaches to sexual reproductive health rights services, I think Jama has provided a very good answer there in her analysis. I'd say we shouldn't be not so much in the forefront in this, but we have noticed that within the COVID-19 response, children are at risk of being sexually assaulted. So we are constantly asking governments and civil society to be on the watch and ensure that children, especially girls, are protected against sexual abuse. It's also true that even when children are actually at home, that more abuse take place because schools sometimes are zones for protection. But I think Jama might provide a detailed answer to this. Thank you.
Yeah. Jama?
So I think it's a very broad one, but like I've shared some of the examples. One of the areas that we are very concerned about also is with regards to certain harmful practices like female genital mutilation and child marriages, where these lockdowns are happening, girls are no longer going to school. And so families may be forced, especially for households, for example, families may be forced to take some of these measures to survive, which is what has been some of the driving factors of some of these practices as well. Now, you have countries where there's legislation against these practices. The Gambia is an example, but we know that they're still continuing, and children are the ones most at risk of these things happening. I think from another gender perspective, I just wanted to share, and this links also to the point that Joseph raised about education. So in Gambia, the Ministry of Education has introduced online learning or virtual learning using the national television and the radio stations. But what we're noticing is that in certain households, have girls who are not able to follow these lessons because they're at home and now expected to contribute to the household chores. And so they're missing out on essential education services that are being provided for children. It gets even worse in areas where they probably don't even have access to a television, radio. So the implications are broad. The lockdowns also mean that children are being forced to stay in homes where they're probably living with people who are molesting them, who are abusing them in so many different forms, and they're not able to speak up about these experiences. I think that there's a very broad range, still a lot of learning that is happening, but there are clearly very big examples and concerns around the violation of the rights of children from a sexual and reproductive health perspective.
Thank you. Theophilus, take note of the questions that were posted on the chat.
Yes, so I had some interference with my screen reader. However, I was able to see 3 questions. I don't know if I have more, but let me respond to the three.
So the last one was from Wilson, and then you had a few questions.
Yes, I saw the one from Wilson, one from
then I think you have
Ilorin.
then I think you have seen all of them, and then you can respond. Yeah, thank you.
Okay, so I have a question from University of Ilorin talking about physical abuse of persons with disabilities at this era. Yeah, we have some reports of abuse of persons with disabilities, especially by security agents trying to enforce the lockdown. And for that, a lot of DPOs are on the issues trying to interface with the relevant authority to see that justice is done and that the perpetrators are brought to justice. So I'm aware that one of our grantees, the Association of Lawyers with Disabilities, and another, the Nigeria Association of the Blind, is also working with the police in Abuja to address the issue of a recent assault of a blind lawyer who was trying to attend to certain persons who could not access some of the support that are available. So yes, those issues have been addressed. We are only hoping that justice is served at the end of the day. So I received another question that one from Okwe. I am trying to remember what that says now. Well, I'll get to that. I hope I remember before I finish responding to Wilson, who asked about working from home for persons with severe disabilities. Yeah, I think on the positive side, from the experience of COVID-19, where people are asked to work from home, it goes a long way to put the argument of those who advocate that persons with severe disabilities are given the opportunity to work from home, because this has shown in many ways that those things that people achieve even while going to the office could also be achieved from home. So where there is mobility difficulty or some other forms of barriers that prevent a person with a disability from working from office, I think working from home could be a good opportunity for persons with disabilities. I've been working from home and I've been doing so well at this period and even before now, and I think it's a good advocacy strategy for persons with disabilities to have that chance to do the working from home. I'm sorry, Magnus, I could not remember the third question from.
Okay, for Ope's question was, the Nigerian government has been distributing funds and other forms of assistance to indigent Nigerians. What is the Disability Rights Fund to advocate for persons with disabilities in Nigeria who are at the intersection of disability and poverty during this pandemic?
Okay, yeah, it is true that the government have been giving out lots of palliative food and money to people it considers to be the poorest of the poor that are in need of that. And of course, persons with disabilities, as we know, are also a lot of people with disabilities are living below the poverty line and are also deserving of such intervention. So it has been noticed that persons with disabilities are left out of these interventions in many states and even by the federal government. So recently I've been working with some organizations of persons with disabilities to interface with the government, especially in Abuja, the Federal Capital Territory level, and that is yielding some results. The government is agreeing now to work with the organizations of persons with disabilities in order to determine how best to get to persons with disabilities, since there's actually no data as to their addresses and what they do and their status in the society. So yes, it's an issue that the disability community is trying very hard to address. And the only way that can be done actually is by the government agreeing to work with these organizations of persons with disabilities who know how best to get to their members. And that is currently being done and achieved gradually in very few states.
Thank you. Adi, you had some comment on Jama's presentation. Did you want to raise some issues here?
No, I just felt the issue of testing for pregnant women should be prioritized. However, in countries where we don't have enough test kits, how can we talk about this issue, or how can we emphasize on this issue? Thank you.
Thank you. Jama, any response to that?
I think, like you mentioned, there needs to be a lot of advocacy around the issue, because the problem is also how government is allocating resources for COVID-19 response. Are the resources being channeled into the priority areas? So if we push for more advocacy and say testing is what is needed, because this is really the message that is going around on the global space now. Test, 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 and that is how we'll be able to get a real picture of what the cases are looking like, especially where we're moving into situations where a lot of people who are presenting as positive are actually asymptomatic. So testing is really the way to go. And so there needs to be a lot of advocacy for government to look at what areas they channel their resources, and testing should be one of those really key priority areas.
Thank you. I think we're still almost running out of time, but I think we can go a few minutes over. I think I open up the floor now for anyone who wants to come in and make a comment, contribution, or ask another question, something that I left out.
Yes, Professor Magnus, if I'm permitted.
Yes.
Yes.
Yes, Samuel, go ahead.
Yes, I'm sorry I came a little late. Was issue of movement. Actually, I'm here. I missed a lot of the presentations. I just want to make a comment. I want to make a comment on a group of persons which were vulnerable at this particular time of the COVID-19 crisis. And I'm looking at those who are actually in remand and in the prisons in the Gambia. Actually, they are more exposed because the prisons are generally overcrowded. There is not enough space. The capacity is low compared to the amount of inmates that are there. And so there is a high possibility of the spread of this virus. Actually, the government has taken some very important steps, allowing for bail applications to be made for a particular group of persons that are under remand. I'm talking about those who are accused of felonies, but which do not include offenses of rape and murder. Any other felonies are those offenses which can be brought to bail. So what we are doing as the National Agency for Legal Aid is to make bail applications before the courts. And there's a possibility that most of those bail applications will go unopposed by a counsel for the state. So we are hopeful that with these mass bail applications, we can get a lot of remand persons out of prison in a view to decongest the prison and to limit the spread of this virus. Inmates continue to remain a vulnerable group during this crisis, and we hope that our efforts in the Gambia, which is being done also in many other African countries where we have prisoners released in a bid to decongest the prisons. This is the contribution I have to make. I'm sorry that time is short, so I really cannot take much of the time to talk about this issue. Thank you.
Thank you. We'll have more seminars coming up in the coming weeks, so we can see if you want to develop further. Other comments, questions from the people in the audience? I mean, other issues around vulnerability as well that you want to highlight, like Samuel noted in relation to prisoners?
Hi, Magna.
Yes.
So I have typed a question up there, but my question is to the man from Nigeria. And I just wanted to check in with them about the issues persons with visual impairments are having with communications from the, official communications avenues of the government, and see what can be done to properly include persons with visual impairments. So that, for example, like he mentioned with captions. So I just wanted to know if there are things that are particularly needed. There is a way that I can pass such an information along to the National Center for Disease Control. Thanks.
Thank you. Theophilus, your response to the question?
Okay, thank you very much. Yeah, on accessible information, especially for the blind, there have been some engagement with the Presidential Task Force as well as the NCDC on the need to provide accessible information. And just yesterday, the Minister of Information did acknowledge that when he stated that efforts are on the way to ensure that IEC materials that will be released are also released in Braille and other accessible format in order to get to all sectors of the society. We will, of course, continue this engagement until we start to see results. But that briefing yesterday was a testament to show that there's something going on. There are those engagements going on with the relevant bodies. We are just waiting to see the actions and when they come into place.
Thank you. Anyone else who wants to make a contribution?
Oh, hello everyone.
Yes.
Oh yes. Thank you for sharing the experiences. I wanted to just share what is happening in Kenya as well. So when it comes to the curfew and the lockdown in Nairobi, we are seeing that the police, of course, are refraining from holding up, persons that defy curfews in police cells. And now what you're seeing is that persons who are arrested outside the curfew hours are quarantined in facilities and are required to pay a daily amount of 2,000 Kenyan shillings. That's approximately how much is that? 200 USD per night, and therefore we have seen concerns that these quarantine facilities are actually not helping flatten the curve, because a lot of people are being arrested outside the curfew hours, and they're all being taken to these quarantine facilities. So while the police are trying to ensure that they do not hold up people in cells, the other side to it is that people who are caught outside the curfew hours are being taken to these quarantine facilities, where they still risk being exposed to infections in these quarantine facilities. And then even the amount that they're being asked to pay in these quarantine facilities is not reasonable, because a lot of people cannot afford this right now because a lot of people are out of jobs. So that is what is happening in Kenya right now. Yeah, I just wanted to share that.
Thank you very much. And I mean, we'll come back and discuss various themes in the coming weeks. We'll have weekly seminars at this time on Thursdays until the end of May. So also, if you want to come in and do participate in the panels and so forth, you can always let us know. Other questions, comments in relation to our discussion today?
Hello.
Yes. Yes.
Hello, Magnus. Thank you very much. Thank you very much for the opportunity, and my apologies for being late in the meeting. I just want to express my views in relation to two key areas. One is that when listening to Jama's presentation, in fact, all the presentations, one issue that seems to be key is that screening and testing is what should be done first. As you can realize, in Lesotho, so far we have 0 cases, and we have the fears by the general public population that if the screening and testing is done mandatorily, as the government intends to do, then there are chances of people being infected from the testing kits by themselves. So I'm asking from colleagues in whose countries the testing has been done, how do you allay people's fears in relation to being infected by the testing process itself? How do you make people ready for the screening and testing so that when government initiates the testing and screening, they does not meet resistance? My second issue is in relation to the curfew and lockdown. We have moved from total lockdown of 21 days. So far, we have what is termed partial lockdown. And what was experienced during the first days of the total lockdown was torture of the people who were found in the streets by the military, and not so much like telling the people to go back home. Rather, they were being forced to go back home. And there are a number of cases, one of them which ended into someone breaking their legs and arms due to the torture by the military. So my contribution is that at the moment, we had in Lesotho, because of the 0 cases, which we don't know whether it's because there is no COVID-19 or whether it's due to lack of testing, people have become more relaxed. Whatever measures were being taken as precautions are no longer in place. How do we protect the people from getting infected under the circumstances? Thank you.
Thank you. I think on the testing, I mean, currently they are just being done by swabs. So I mean, I don't see how one could be possibly be infected by that. But since we have a testing expert among us, Jama, perhaps you want to respond to that issue.
So just a disclaimer, I work just in the communications,
okay.
communications angle, but I think I can provide a response. So it's basically with regards to the possibility of resistance from the public when it comes to testing. And this is something we're already seeing in the Gambia. Now, when contact tracing is happening, so this is basically trying to reach the people who may have come into contact with positive patients. We're facing a lot of resistance from the communities because people are afraid, one, of the pain that they perceive comes with the testing, because they're pushing swabs into people's noses. And so there is a sort of lack of understanding on what really this process is about. But one of the gaps that we've also identified is that there's not a lot of counseling, or rather there's not adequate counseling being done before the tests are taken. So how do people understand the steps that are involved? So we're taking your swabs. This is what we're going to do. If the outcome is positive, this is what is negative, this is what will happen. So I think one of the things that can be done is to have clear guidelines and use psychosocial experts to really connect with the people and get them to understand that I cannot say there's nothing to be afraid of, because I think that will be a bit insensitive, but that there are systems in place, there are protocols in place that guide the testing process. I think all of it really lies on how the authorities responsible are communicating to the public, how they're trying to allay their fears, but also just getting them to understand what the processes are, where there is transparency, where people know what is happening, where people understand what is happening, there is a tendency that they will be cooperative. Right now, we're not getting that. People are actually refusing to be tested, which leads to the government and the Ministry of Health now having to apply force, which raises questions around the ethical considerations, but also around how their rights are being violated if they're not willingly coming forward to be tested. On information. Once people are aware about the processes, it is transparent, communication is happening on a regular basis, some of these things can be taken care of.
Thank you. So I think on the broader issue around also security forces and so forth, I'm sure that's an issue that we have in many countries across Africa and beyond. And I think that's something that we also get back to in a later session. Anyone else who wanted to make some last comments before we wrap up these sessions?
Thank you, Magnus. Thank you, Magnus. My name is Johnson Mayamba. In addition to what Jama has submitted, among other groups that affected by the lockdowns, I can say the people living with HIV, like it has been submitted that most hospitals now are relegating other services and putting forward COVID issue. In Uganda, most of people living with HIV live in far places from health centers, and there is a ban on public transport and all kinds of movements. So people who used to go to hospitals, say, periodically to receive these medicines at disadvantage at the moment because they can't walk long distances to the health centers, and also when they reach there, the excuse that is given is that the priority is being given to COVID treatment. Another vulnerability group that is at disadvantage, I can say, is the homeless people, say people who have fled their homes because of, especially the sexual minorities who have fled their homes because of homophobia, and street kids. There's a ban on gatherings, on movement. So if they are sent, if they are pushed away from the streets, where are they going? Right now, right now, there's only just one organization that has come up to help the street. But for the sexual minorities who have found shelter where they can go and seek refuge, we've seen that in Uganda, some of them have been raided by the government and they are being imprisoned for disobeying presidential directives. Another group that is being affected by this is the media, the journalists. The ban on the movements and gatherings has affected them in a way that some of them, because they work in teams, they cannot work in isolation. So the ban on gathering in a way affects their work. And when you say there is a curfew from 7 p.m. to 6 a.m., most of these journalists report to work way earlier than anyone else and leave the newsrooms very late compared to the rest of other people in other service areas. So in a way, this affects the work and this dissemination of information that is very much needed at the moment, because most of the population, say in Uganda, does not have access to internet, so you can't say that they are going to get all information on internet. So they depend mainly on radios, televisions, and newspapers. So if there's a limitation on the work that the journalists do, that means there's going to be an effect on the way information is disseminated among the population. And that's what I want to comment. Thank you.
Thank you very much, Johnson, for highlighting those additional contexts of vulnerability. I'm sure that we will come back to many of these themes in the coming weeks. We're also setting up a database that will be available on our website, and we'll collect materials around this. And you might also be called on to assist us in that regard. But thank you very much, particularly to our panelists, but everyone who has contributed and everyone who has listened in. And as mentioned, the recording of this session will also be available on the Center's YouTube channel in due course. Thank you very much.
Thank you.
Thank you very much, Professor Magnus. Hopefully we meet again next Thursday.